Time now for Back to the Basics in Healthcare with Balanced Life Chiropractic, and we have Dr. Harley joining us. We're going to talk about people maybe expecting a child. I think this is kind of cool thing to talk about.
Yeah, spring always makes you think, new life. It's a great time to start thinking about starting a family. And yeah, let's talk about it. Some of the most common things that women deal with when they're pregnant is low back pain. It's a lot of them, or hip pain, sciatic pain, a lot of those things.
And it's from added weight that they don't typically have, but they have it because of the baby that's inside there.
Right, especially as that baby's growing, that's putting a lot more force and weight on the hips. It's going to be putting a lot more pressure on nerves and making muscles work harder. So we really start seeing a lot more hip and low back pain, especially towards the later parts of the pregnancy. But even early on, morning sickness is pretty common, or, lightheadedness, dizziness, kind of some of those things. Just as your hormones are changing, your body's changing as you're growing this new life. A lot of people don't necessarily think about, chiropractic. Maybe I should go see a chiropractor.
But it's a good idea.
Yeah, it's a fantastic idea. We really help women through their entire pregnancy. Sometimes it's even just getting pregnant. If they're dealing with infertility issues or menstrual disruption, stuff like that, we can help regulate that, helping them to track easier, helping them to get pregnant a little bit easier.
Very nice.
And then, with the nausea, some of the stuff in the early stages, just helping make sure that their nervous system is functioning to its best, helping them to grow that life, much more easily, much more efficiently. And then, of course, towards the later parts, as their hips are locking up, not moving as much, using what's called Webster's technique to really see how their hips and sacrum are rotating and moving, helps us to unlock those hips, make sure they're moving really well. I look at, the placenta as it's growing, the baby, kind of like a giant hot air balloon.
Oh.
And it's a good way of looking at it because there's a lot of different ligaments that attach to your pelvis. And so the pelvis would be like the basket of that hot air balloon.
All right.
And if your hips are rotated, it's gonna twist up a lot of those tethers that are attaching to the placenta and the uterus where it's holding the baby. And if it's really tight and tense and it's not allowing that baby to move properly, well, that's gonna
make a big difference.
Cause a lot more back pain. It's gonna hinder some of the labor and birthing process, causing for longer labors, more painful labors. So that's where we use that Webster's technique to help untwist the hips. That's gonna ease up the pressure, helping baby to move better, help reducing low back pain, speeding up delivery times and reducing labor pains.
And these are all good things.
Those are all good things. I don't know what mom doesn't want to know that.
Yeah.
So even if you're, 36 weeks pregnant and you're expecting in a few weeks, or you're, just starting your journey, chiropractic's a great thing to add on at any point. But I'd say don't wait, start now kind of thing.
And for somebody listening that, like you were saying, maybe even they want to start that process, but they're not even there yet, this is a good thing to start very early.
Yeah, it's always good to get your health in line and in check now, because the things that you have going on now, are only going to get worse when you're pregnant, because, pregnancy does a lot of things to your body, not just, growing a baby, but it's going to affect your overall health as well. So it's good to, start thinking ahead now. That way you're not dealing with those things and the common things that come with pregnancy.
And then once that baby's born, how young are they when you do the first adjustment? Do you do like right when they're baby?
It really depends on mom's comfort, mom's preference. As soon as they're ready to get up and about, I think the youngest I've adjusted was 3 days old.
Oh, wow.
I know some chiropractors, their own children have been minutes old. So there's really no timeline. It's really just the mom's preference. If they want to wait a week or two before they're up and about, and, can depend on the birth process, if there was trauma with the birth process to the baby, or, more of a quote unquote normal birth. I mean, all birth is hard on mom and hard on baby, but, some have more complications than others.
If somebody listening would like to learn more about this, or maybe some other topic that has to do with chiropractic, how do they get a hold of you?
They can give us a call at 605-215-1785. Even if they have a question, they're like, hey, I heard you talk about this. I would love to know more about it. All of it starts with a conversation, or they can reach out to us on our Facebook page at Balanced Life Chiropractic. We'd love to chat.
Very nice. You can find their website and their phone number and all of their information online at BalancedLifeSD.com.